Hi everybody, Devin here talking about all things data, and today we're going to talk about interview questions when you're hiring a database administrator. So let's go ahead and get right into it. A database administration for healthcare is just a little bit different than it is in other aspects, although there is a lot of carryover. You know, if you're a DBA in banking, you know that you have to go through a bunch of compliance issues, and you know the compliance issues are kind of sort of the same in healthcare. But they have different names. But it's really good, especially if you're hiring like a senior DBA or a lead DBA. You really want someone who has specific healthcare experience. So these questions, I'm going to go through about 3 of them. I've got 15 on the website, so here are going to be 3 of them. Here are the 3 of the important ones that you want to ask your DBA when hiring a database administrator for a healthcare service. So number 1 is, what experience do you have with healthcare-specific databases and electronic healthcare record systems? And obviously, you're talking about SQL, Oracle, Postgres, Mongo, Maria, whatever your hospital is sitting on. Probably all of the above, to be honest. But make sure they have familiarity with at least most of the major ones that you're using, which are probably SQL and Oracle. Postgres, Maria, everything else should be a relatively small footprint comparatively. But make sure that they can handle all those technologies that are important, and then make sure that they are familiar with the APIs for the most common tools that are using those SQL environments. So for your Epic data platform that's sitting on top of SQL, utilizing that is going to be just a little bit different than other pieces of software. And if you're hiring a lead DBA or a senior DBA, you probably want to try to find one who has worked with those platforms before, so that they aren't completely surprised by what they're seeing, and they can help mentor and show the junior people on the staff exactly what's going on and how to fix problems. So making sure that they're familiar with your specific software and data platforms and the APIs that use them. And then number 2 is just going to be me, on my soapbox a little bit, HIPAA. Make sure that your DBA can explain the role of a DBA for a healthcare organization that obviously is concerned with regulations. For a long list of reasons, you need to make sure that your data is secured. Obviously, best practices, you don't want your clients knowing that their data is out there, even if there wasn't a fine hanging over your head. But, of course, there are those big fines hanging over your head because at some point you will have a data breach, and you need to make sure that you've taken every step possible to ensure that your patient data is protected and that you're following or exceeding all of the HIPAA regulations so you don't get any fines on top of all of the other issues you have to do after you've had that breach. And then number 3 I'm going to give you is making sure that your senior DBAs and your lead data engineers are familiar with all of the APIs you're using and improving data interoperability across all of them. Healthcare is notorious for siloed data. Healthcare is notorious for having 20, 30 different SaaS products that all need to communicate with each other, right? Because your doctor's software is using something different than your nurses. It's using something different from your pharmacy and your billing and the insurance companies. And so you need all of those to work together, including all of your internally built applications and reports and products. That way you can make sure that your business can actually run. So those are your 3 big ones. It's going to be, have they used your HR system before? Are they familiar with the role of DBA in maintaining or exceeding HIPAA and other data security requirements and regulations? And are they familiar with maximizing data performance and data interoperability across a platform, a wide variety of SaaS products? So those are your 3. To get more, head over to our website. Make sure you read it all and leave me a comment. Let me know what did I forget, what did I leave out, or what did you learn? Thank you very much, and looking forward to talking to you soon.